All right. So we've decided to discuss the film A Beautiful Mind.
Who is John Forbes Nash Jr.? John Forbes was a mathematician who made progress in things such as the game theory, differential geometry, and also studied partial differential equations. In A Beautiful Mind, John Nash is portrayed as a professor at a prestigious school who, despite his incredible intelligence, had his life changed by schizophrenia.
Right. So we came to the conclusion that the diagnosis of schizophrenia is classified under schizophrenia spectrum and other psychotic disorders. It involves disturbances in thought and emotion, impaired perception. Some of the major symptoms include delusions, hallucinations, disorganized speech, grossly disorganized behavior, or catatonic behavior, which involves freezing and lack of movement. And some of the negative symptoms for this disorder include non-responsiveness and absence of emotion.
So, evidence in the movie that supports the diagnosis. Two of the present symptoms were hallucinations, which is sensory perceptions that are not real. How this showed up in the movie was Nash believed that he had a best friend who had been his roommate in college, when in reality, he didn't have a roommate in college at all. But even when he was presented with the information that he had no roommate in college, or the fact that his roommate's child had not aged in many years, he was a little hesitant to believe it himself. Another present symptom would be delusions, which is purely cognitive distortion. Nash believed he was an important part in an FBI case, which often led him to do crazy things, and he ended up in really weird places. One of the missing symptoms of schizophrenia that was not present in John Nash's case, at least in the movie, was catatonia, which is a state of immobility due to disturbed state of mind.
So, possible treatment. Um, we decided that the medication should include a low dosage of clozapine due to its ability to help with both positive and negative symptoms. The drug may take about 6 weeks to see effect, so the patient should be monitored during that period of time for side effects and such as agranulocytosis, which could be fatal, and this is kind of an ethical issue that should be considered before prescribing the medication. Other side effects include weight gain, and at high doses, you may see tardive dyskinesia, tremors, visual impairment, and fatigue. Over several months, the patient's symptoms should be fewer and farther between. But once again, the patient needs to be monitored throughout the treatment. Now, film has a very distinct impact on the perception of disorders in our society. With this one in particular, the representation is fairly accurate without too much exaggeration. And the reason why that's important is because we tend to form our idea of what the disorder looks like based on what we see in films. The positive side of that is that if the film is portraying it accurately, then people will have an accurate idea. They can actually have some insight into the struggles that these people face and such. But the negative side of that is that if the portrayal is not accurate and overly exaggerated, it can cause fear or uh, just misunderstandings, and people will avoid them for reasons that aren't true. So, just a general rule of thumb, accurate representation is a good thing, and you should be educated on psychological disorders regardless of how they're represented in film. Unfortunately, not everyone will be. And here are the works we cited, the film, as well as the DSM. Thank you for attention.